Have you ever considered whether a seemingly simple skin condition could completely dictate your relationship status?
Oh, definitely. I mean, it sounds almost like an exaggeration when you frame it that way.
Right.
But for a very specific, frequently hidden condition, that is the exact reality.
Yeah.
The physical symptoms basically trigger this massive silent avalanche that can just completely bury a couple's connection if they don't know what they're dealing with.
Absolutely. So welcome to the deep dive. Today we have a highly specific mission.
We do.
We are taking a massive stack of medical guidelines. So this includes protocols from the British Association of Dermatologists, National Health Service leaflets, and some incredibly revealing qualitative research to answer a deeply personal question for you.
The big question.
Exactly. Can a condition called lichen sclerosus, or LS, cause relationship problems?
And, whether you are managing a chronic condition yourself, or maybe you're supporting a partner, or you're just someone who loves understanding the complex intersection of human biology and emotional connection.
All right, this deep dive is designed to give you a really thorough look into this. We aren't going to shy away from the medical jargon today either.
No, we really need to break down exactly how this works on a cellular and psychological level so you can truly understand it.
Okay, let's unpack this. Because before we can even begin to understand the relationship fallout, we have to grasp the physical reality of the condition itself.
Right, because the biology kind of dictates the psychology here.
Yes. Yeah.
So the physical reality of lichen sclerosus is the foundation of everything that follows. LS is a chronic inflammatory skin condition that primarily affects the genitals and the skin around the anus.
Right.
And right off the bat, looking at the clinical guidelines, there is some major myth-busting we really need to do.
Oh, absolutely. This is so important.
Yeah, first off, it is not contagious.
Not at all.
It is not a sexually transmitted infection, and it is entirely unrelated to poor hygiene.
Which, I mean, the frustration for patients must be immense because the exact cause is actually still unknown.
Yeah, it's really tough.
But the evidence in our stack strongly points toward an autoimmune factor. Basically, the immune system gets confused and begins attacking the basal layer of the skin.
Right, that foundational layer when new skin cells are generated.
Exactly. And this attack fundamentally alters the architecture of the tissue.
It really does. When the immune system is constantly attacking that basal layer, it destroys the skin's collagen.
Which we need.
Right. Collagen is the protein responsible for structure and stretch. So the affected skin turns very pale or white, and it develops this extremely fine, crinkled texture.
Reading through the clinical descriptions, the mechanics of it remind me of, like, a flexible rubber band versus wet tissue paper.
Oh, that's a really good way to put it.
Yeah, normally our skin is like that rubber band. It has elasticity, it can stretch and snap back, especially in areas subjected to friction.
Right, of course.
But because LS destroys that collagen, the skin is robbed of its elasticity. It essentially turns into that wet tissue paper. So the moment you introduce the basic stretching and friction of sexual intimacy, that fragile skin simply gives way. It leads to painful micro tears, fissuring, and bleeding.
That transition from a rubber band to wet tissue paper is a perfect way to visualize the mechanism. And the physical trauma goes far beyond temporary tearing.
Yeah, it gets much worse.
It does, because if this inflammation is left untreated, the body tries to heal those micro tears, but since the environment is constantly inflamed, it heals with scar tissue.
Oh, wow.
Yeah, and over time, this scarring physically and permanently alters the anatomy.
It actually changes the shape.
Yes. In women, the inner lips of the vulva can actually fuse together. The clitoris can become completely buried under thick scar tissue, and the entrance to the vagina can narrow so significantly that penetration becomes anatomically impossible.
That is just, it's
Yeah.
terrifying to think about. And it affects men too, right?
It does. For men, the scarring can cause the foreskin to tighten uncontrollably.
Right, the clinical texts refer to that as phimosis.
Exactly. And this makes erections incredibly painful, causes tearing during sex, and in severe cases can even lead to urinary obstruction.
So we are talking about a devastating mechanical failure here. You have this vital, highly sensitive part of the body that is essentially losing its structural integrity.
Yeah, that's exactly what's happening.
And we really need to introduce the medical term here, which is dyspareunia,
Yes.
which simply means deep, recurring pain during sexual intercourse. I mean, this isn't a brief infection you take a round of antibiotics for. This is chronic structural damage.
What's fascinating here is how severely misdiagnosed this condition is, despite causing such profound physical changes.
That's shocking.
You would think a condition that literally fuses skin together would be caught by a doctor immediately.
You really would.
But one study in our qualitative research stack highlighted an average diagnostic delay of 4.6 years.
That's almost 5 years.
And in one extreme case, a patient waited 51 years for a correct diagnosis.
51 years. Oh my God. Just imagine you are the one sitting in the doctor's office hearing that.
I know, it's unbelievable.
Or even just the average of nearly 5 years. That means couples are sitting in the dark for half a decade, suffering, having no idea why intimacy suddenly feels like tearing wet tissue paper.
They're essentially fighting a ghost. And, because it's a genital condition, a massive layer of embarrassment prevents people from pushing back when a primary care doctor casually dismisses the symptoms.
Right. They just say, oh, it's a standard yeast infection.
Exactly. Or a reaction to soap. Or simply menopausal dryness. And patients internalize that dismissal, they assume it's normal, and they just stop asking for help.
Which means we need to look at the next stage of this avalanche. Because if the physical pain of this condition is that severe, it makes total clinical sense that a patient would avoid intercourse.
Oh, completely.
But looking at the qualitative research, the true tragedy is that the avoidance doesn't stop at the bedroom door. The physical pain actually rewires the brain's entire approach to intimacy.
To understand the neurological mechanism behind this, we have to look at how human desire functions. So, the research outlines two primary types of desire. There's spontaneous desire and responsive desire.
Spontaneous is the Hollywood version, right? You just randomly feel aroused out of nowhere.
Exactly. But for a massive portion of the population, desire is responsive. It requires a trigger.
Like pleasurable touch.
Yes. It is activated by pleasurable touch, by a relaxing environment, by the buildup of intimacy.
But the problem with lichen sclerosus is that touch no longer equals pleasure.
Right. Touch equals tissue damage.
And I'm looking at the neurology of this, and it's fascinating. Arousal requires the parasympathetic nervous system to be active, the rest and digest state.
Yep.
But pain, or even just the anticipation of pain, triggers the sympathetic nervous system, the fight-or-flight response. You cannot physically be in both states at once.
You really can't. The sympathetic nervous system completely overrides the arousal process.
Oh, wow.
Yeah, when your brain associates a partner's touch with tearing and burning, that responsive sex drive just evaporates.
Shuts down.
Completely. Your nervous system is literally doing its job. It is trying to protect you from a perceived biological threat by shutting down any physiological response that would lead to that damaging friction.
And the sources describe this heartbreaking phenomenon where this neurological override cascades into everyday life. Patients actually begin to avoid all day-to-day affection.
Yeah, the intimacy cascade.
But wait, isn't it just about avoiding sex? Why does holding hands have to stop? I understand avoiding intercourse because of the friction, but the research shows people stop holding hands. They avoid a casual hug in the kitchen.
That is the insidious nature of chronic illness infiltrating the mind. To explain why a simple hug becomes terrifying, the researchers draw on data from another chronic illness called Sjogren's syndrome.
Sjogren's?
Yeah, it's an autoimmune disorder that causes severe bodily dryness, and it shares very similar intimacy-destroying symptoms with LS.
Right.
So the researchers use a sociological concept called biographical disruption.
Biographical disruption. So the idea that a chronic illness shatters the narrative you had written for your own life.
Exactly the point. You have this established idea of who you are, how your body reliably functions, and what your romantic future looks like.
And then it changes.
Suddenly, your body becomes an unreliable, fragile vessel. You become hyper-aware of your physical limitations at all times.
Ah, I see.
So for someone with LS, they engage in a rapid mental calculus. A hug might lead to a kiss might lead to the bedroom, and the bedroom leads to physical trauma.
It's the ultimate slippery slope. By cutting off the affection at the very root, the hand-holding, they never have to face the friction of the bedroom.
Exactly.
They intentionally quarantine themselves from all romantic cues as a form of self-preservation. It protects them from the physical tearing, but just as importantly, it protects them from the crushing emotional guilt of having to reject their partner yet again.
And the psychological surveys in our stack reveal the brutal aftermath of this emotional quarantine.
It's devastating.
It is. Patients report deep, pervasive feelings of sadness, embarrassment, and just a total collapse of self-confidence. They begin to feel fundamentally undesirable. That makes so much sense.
Yeah, the disease physically alters the appearance of their genitals, often causing immense shame, while the constant anticipation of pain mentally drains their capacity to feel like a vibrant sexual being.
But intimacy, though, is an ecosystem.
Right.
It requires two people.
Yeah.
So we really have to shift our focus to the often overlooked half of this equation.
The partners.
Yes. Imagine you were the partner in this scenario. For that average 4.6 years before a diagnosis is ever made, you have no idea about the autoimmune response.
You know nothing.
You don't know about the collagen destruction or the micro tears. You just know the person you love flinches when you reach for their hand.
And the partner's experience is characterized by intense confusion and distress. Without the medical context, they naturally internalize this sudden, inexplicable withdrawal.
They blame themselves.
They do. They assume it is a failure of the relationship itself, or they believe they have suddenly become profoundly unattractive to their partner. The foundation of their romantic connection just feels like it's crumbling without any logical explanation. And let's say they finally get the diagnosis. The 4.6 years of waiting are over. The partner finally understands the mechanical reality of the condition. You'd logically think that solves the emotional wedge, right?
You would hope so.
But the research shows it just introduces a completely different psychological, intense anxiety.
The anxiety of causing harm. The partner becomes terrified of causing the person they love physical pain.
Of course they do.
And the research highlights a fascinating biological response to this anxiety. It can actually cause secondary sexual dysfunction in the partner.
Wait, really?
Yes. The psychological stress of navigating their partner's fragile skin can lead to erectile issues in men or cause the partner to withdraw from intimacy entirely just to guarantee they keep their loved ones safe.
So you end up with two people, both deeply in love, both actively pulling away from each other to protect the other person from pain and guilt.
Exactly.
And looking at the clinical outcomes, this creates an environment researchers term the silence trap.
The silence trap is a really powerful psychological coping mechanism. The couple basically makes an unconscious, unspoken agreement to simply forego their sexual relationship entirely.
They just stop trying.
Yeah, they adopt a mutual strategy where ignorance feels much safer than confrontation.
Because addressing the loss of their sex life means they actually have to grieve it. And grieving requires immense emotional labor.
It really does.
And once you grieve it, you have to do the exhausting work of trying to fix it or redefine it. It makes total sense that for many couples, the fear of conflict or the terrifying admission that their relationship has permanently changed is far scarier than just staying quiet.
Oh, definitely.
So they sleep in the same bed, miles apart, never mentioning the elephant in the room.
And the silence is corrosive. But the research points out a scenario even darker than the silence.
Oh, no.
Yeah. Some patients, terrified of losing their partner or feeling an immense burden of guilt, actively endure the dyspareunia.
They just push through the pain.
Exactly. They grit their teeth and push through the physical tearing simply to maintain their partner's sexual identity and keep the relationship stable. They engage in intimacy out of a grim sense of duty rather than any mutual pleasure.
Which is a catastrophic strategy.
Yeah.
It is physically damaging because the friction actively worsens the scarring and fusing.
Yes, it makes the physical condition worse.
And it is psychologically devastating because sex is literally transformed into a traumatic, painful chore. It reinforces to the nervous system that touch is a threat.
Exactly.
So what does this all mean? If we step back and look at the trajectory here, we have an autoimmune condition destroying tissue, a nervous system overriding desire, and two partners trapped in an anxious, guilty silence.
If we connect this to the bigger picture, the physical condition of lichen sclerosus operates as the catalyst for a massive systemic communication breakdown.
A total breakdown.
The loss of physical touch is compounded by mutual shame. It creates a wedge that, if left unaddressed, will slowly but surely erode the foundation of a relationship. Yeah, it is rarely the skin condition itself that ends the partnership. It is the silence, the assumptions, and the unaddressed grief surrounding it.
That is an incredibly heavy reality to process. But, as we promised you at the top of the deep dive, our mission isn't just to map out the pathology of the problem.
No, there is hope.
The clinical guidelines from the British Association of Dermatologists and the patient support literature provide a highly actionable, scientifically backed roadmap for couples to navigate this disease and completely reclaim their connection.
The outlook is actually very optimistic if the right steps are taken. The absolute first line of defense, and the medical guidelines are incredibly rigid on this, is proper, consistent medical treatment.
Right.
You cannot outcommunicate active tissue destruction.
You really can't. We are talking about ultra-potent topical steroids, specifically medications like clobetasol propionate ointments. And what really struck me in the research is the mechanism of these steroids.
It's really
They aren't just, over-the-counter anti-itch creams masking a symptom.
far from it. They are doing heavy lifting at a cellular level.
Okay, break that down for us.
So when clobetasol propionate is applied, it enters the skin cells and binds to specific glucocorticoid receptors.
Right.
This binding process essentially signals the cell's DNA to shut down the production of inflammatory proteins. By forcibly halting the autoimmune attack, the fibroblasts in the skin finally have a chance to repair the collagen.
Oh, wow.
Yeah, the steroids actively heal the microtears.
And crucially, by stopping the inflammation, they prevent the irreversible scarring and anatomical fusing we discussed earlier.
Exactly.
If a patient gets on this ultra-potent steroid regimen early and maintains it diligently, they can essentially freeze the physical progression of the disease.
That's the goal.
The clinical texts also specifically note that ointment bases are far superior to creams for genital skin, as ointments contain fewer preservatives and water.
Right, which drastically reduces the chance of further burning or irritation.
Exactly. It is a vital clinical distinction. But stabilizing the tissue is only the first phase.
Yes, the physical part.
Right. Once the skin is physically healing, the couple has to heal the mind and the relationship. The qualitative sources emphasize the absolute necessity of redefining intimacy.
This is where the profound psychological work begins. Couples have to actively unlearn everything the standard societal script has taught them about what constitutes real sex.
Oh, totally. The standard script is incredibly narrow. It's just foreplay, penetration, completion.
Yep.
LS forces a couple to throw that entire script in the trash. The literature mandates the use of high-quality, non-irritating lubricants to reduce any residual friction, but more importantly, it encourages a radical expansion of the sexual menu.
It requires shifting the goalposts of intimacy, exploring sensual massage, mutual masturbation, or simply spending time naked together without the implicit pressure of penetration.
Right.
It is about respecting the new physical boundaries and, crucially, rebuilding trust and touch.
Because of the nervous system overriding.
Exactly. The patient's sympathetic nervous system has learned that touch means a biological threat. They require slow, consistent, entirely positive physical experiences to teach their brain that the parasympathetic rest and digest state is safe to enter again.
And breaking out of the silence trap to orchestrate this new intimacy is incredibly difficult to do alone.
It really is.
The sources heavily recommend utilizing psychosexual counseling. Having a neutral, highly trained third party to help navigate the grief, the guilt, and the mechanics of this communication is often the key to unlocking the wedge between partners.
Counseling can be a game changer.
But what if you aren't in a couple? Navigating this within an established marriage is one thing, but our sources actually offer a literal word-for-word script for listeners who are single and trying to navigate the overwhelming anxiety of dating with LS.
The prospect of disclosing a genital skin condition to a new partner is terrifying for most patients.
I can imagine.
It triggers massive fears of rejection. But the advice provided in the support literature is brilliant in its straightforward simplicity.
What do they suggest?
Rehearsing a clear clinical disclosure removes the pressure of trying to find the right words in the heat of a romantic moment.
Right.
The recommended script goes something like this. I just want to let you know I have a skin condition called LS. Please, can we take sexual touch a bit slowly and see how it feels? I will let you know what is good for me.
Wow, it's remarkably empowering.
It really is.
It instantly sets a boundary. It completely removes the mystery for the new partner so they don't jump to conclusions about STIs, and it immediately establishes open, honest communication.
Exactly.
Here's where it gets really interesting for me when looking at all these prescribed solutions. Managing lichen sclerosus effectively forces a couple to build vastly superior communication skills compared to the average healthy couple.
Because the average couple relies entirely on assumptions.
Exactly. Without a chronic condition, couples can get lazy. The standard societal script just carries them along on autopilot.
Yep.
They rarely have to sit down and explicitly articulate what hurts, what feels pleasurable, or where their hard physical boundaries are.
They don't have to think about it.
Right. But a couple dealing with LS autopilot, leads to tissue damage.
Yeah.
They cannot be lazy. They are forced to talk about the mechanics of their intimacy with absolute precision.
This raises an important question about how our culture defines successful intimacy.
It really does.
We have this incredibly rigid, penetration-focused view. Overcoming a chronic condition like LS requires entirely abandoning that standard cultural script.
You have to throw it out.
You do! You have to consciously design a bespoke sexual life that works specifically for your unique biology and your partner's psychology.
Right.
You are no longer just performing intimacy by rote. You are actively, intentionally creating it together.
Consciously designing your intimacy. That is a brilliant framework. So let's recap the highly specific mission we set out on today.
Let's do it.
We asked if lichen sclerosus can cause relationship problems. The clinical and psychological data say undeniably yes.
Yes, it can.
It mechanically alters the tissue, turning resilient skin into fragile tissue paper. It triggers a sympathetic nervous system override, causing psychological avoidance of all physical affection to protect against pain.
Right.
And it creates a devastating silence trap of mutual guilt between partners.
However, the data also clearly shows it is not a relationship death sentence.
Not at all.
With diligent medical management using ultra-potent steroids to halt the cellular destruction and a commitment to radical honesty, couples can navigate this successfully.
They can get through it.
It requires education, immense patience, and a willingness to completely redefine what connection means to them.
It is entirely about pulling the disease out of the dark and communicating through it.
Absolutely.
Which brings me to one final thought to leave you with today. We started by examining the fragility of the skin, the micro tears, and the total breakdown of the emotional bond. But if chronic conditions like LS force couples to completely dismantle the assumed lazy societal script for sex, if the pain forces them to rebuild their intimacy entirely around customized communication, deep vulnerability, and non-penetrative closeness,
Yeah.
could navigating this terrible, painful hurdle actually create a stronger, more intentional, and bulletproof emotional bond that a couple might have ever developed without it?
It is a profound shift in perspective.
It is, isn't it?
The very pathology that threatens to tear the relationship apart might just be the exact catalyst required to make their communication and their connection truly unbreakable.
Something for you to mull over as you think about the mechanics of your own connections. Until next time.